Hello, today's class we will be studying about local anesthetics. So, to begin with, what is local anesthetics? These are a group of drugs which are applied topically or they are used as a local injection. Okay, they can be applied as a topical preparation or as an injection for reversible loss of sensory, that is anesthesia is loss of sensation, right? So reversible loss of sensation, especially pain. Okay, reversible loss of sensation, especially pain at the local site or desirable area. And there is no loss of consciousness, that is without loss of consciousness. This is also very important terminology for local anesthetics. So these are drugs which are topically or topically applied or injected locally. They produce reversible loss of sensory perception. Okay, mainly pain. And they anesthetize the restricted area without loss of consciousness. So this is the definition of local anesthetics. And the order of blockage, this is also very important term. So usually there will be differential blockage, meaning first they will block the smaller nerves, okay, than the bigger ones. And the sensation lost is also different. First sensation, that is sensory, which is lost is pain. Okay, after which there will be loss of temperature sense and touch sense and then deep pressure. So this is the order, this is how it get blocked. So pain sensation is the first thing to get lost. So moving on to the differences between the general and local anesthetics. So general anesthetics, the site of action, as we all know, it is in the CNS, okay? And local anesthetics, the action is on the peripheral nerve. So this affect the peripheral loss of sensation of a particular area is mainly because it will block the peripheral nerves. In this general anesthetics, the whole body is anesthetized. Okay, local, a part of it, part of uh, the body or the restricted area get anesthetized. Consciousness is very important one. In the local anesthesia, there is unaltered, there is no loss of consciousness. And general anesthesia, there is loss of consciousness. Preferential use, the general anesthesia is mainly used for major surgeries. Local anesthesia for minor surgeries like burn dressing, wound, any sutures. In that condition, we use local anesthetics. And in case of uncooperative and poor health patient, it is always local anesthetic. Uncooperative patient, we always prefer general anesthetics. And poor health status, local anesthetics is the safer mode of anesthesia. So moving on to the classification. So they are classified two ways, like it is ester-like local anesthetics or amide-like. So ester-like local anesthetics are those drugs which are cocaine, procaine, chloroprocaine, tetracaine, benzocaine. And amide-like local anesthetics are lignocaine, bupivacaine, dibucaine, prilocaine and ropivacaine. Based on their efficacy and potency, they are also classified, and based on their the mode of action, so and route of administration also. So injectable local anesthetics, based on their efficacy, that is low potency and for which will act for shorter duration of time, they are procaine and chlorprocaine. So these are low potency shorter acting drugs. Intermittent potency duration of action is lignocaine and prilocaine. High potency long duration of action, it is tetracaine, bupivacaine and ropivacaine and dibucaine. So these are high potency longer duration of acting drugs. So drugs which are used as surface anesthetics are cocaine, lignocaine, tetracaine, benzoxynate, benzocaine and oxytazane. So these are used as surface anesthetics, that is for topical preparation. So moving on to the mechanism of action of local anesthetic. So they mainly act by blocking the sodium channels. Okay, so how do they block is the interesting thing here. So see, this is the old sodium channels. This is how it is. Okay, and this sodium channel usually is in three stage, like it can be either of closed type or open type or inactivated type, and this is based on the gate. Okay, so this is the inside of the cell, this is the outside, and this is how the sodium channel enters into the cell through this channel. Sodium ions enters through this channel, and so these have a gated things, and basically this local anesthetics, they do not act on the outside part of the cell, it is mainly inside. Okay, this is one important point to be remembered. So first thing what happens is these local anesthetic, they get diffused into the cell. Okay, and then they bind to the inner surface of the sodium channel, and they increase the duration of action of inactivated gate. They close the channel and the duration of inactivation stage is increased. So thereby the sodium do not enter into the cell. Okay, and it will not generate action potential, and it also raises the threshold for excitation of the cell. So the cell do not get activated and there is no depolarization. That is how local anesthesia is produced. I repeat, it mainly acts through sodium channels by binding to the inner surface of channel. So it will increase the duration of inactivated stage of the channel, and they prevent depolarization of the muscle. So this is also another picture. So there is three stages: resting, activated and inactivated stage. First thing is it will diffuse, okay, and then combine to the and then it acts on the inner surface of the sodium channel, and it will increase the inactivation duration. So one more thing here to be remembered and very important point is usually this local anesthetics are combined along with adrenaline. Okay, why is usually asked for 3 markers and also in your MCQs. Okay, and this is also important. What is the concentration? Different concentration of adrenaline is used for different purpose. Like 1:1000 is used in case of anaphylactic shock. So 1:150, 1:50,000 to 1:2 lakh is the concentration or the dilution which is used along with local anesthetics. Very important point this is. Why it is used? Because it will produce vasoconstriction. As we all know, adrenaline is a sympathomimetic drug, so which has action on alpha 1, alpha 2, beta 1, 2 and 3, right? So through alpha 1 mediated action, it will produce vasoconstriction. Localized vasoconstriction will cause prolongation of the duration of this anesthetic effect. Okay, local anesthetic, because there will be vasoconstriction, so there will be increase in the duration of action of local anesthetic, meaning the local anesthetic which you are injected will stay there. It will not enter into the systemic circulation. So there will be reduced systemic toxicity of this local anesthetics, and there is enhanced intensity of nerve blockage, and it also provides more bloodless field for surgery because it will cause vasoconstriction. So the blood loss is also very less. So these are the 4 important points why adrenaline is combined along with local anesthetics. And the major disadvantage here is subsequently there can be local tissue edema and necrosis due to vasoconstriction. There is decreased blood supply can happen, and there can be raise in BP, or it can also promote arrhythmia. These are the 2 disadvantages, but this is most commonly used and very important question. Why adrenaline is combined with lignocaine or any other local anesthetics? Usually this combination will come. So systemic action, when you give local anesthetics, what happens is CNS, it can cause depression. Okay, and in case of overdoses there can be numbness, tinnitus, okay, abnormal sensation in the tongue, dizziness, blurred vision, drowsiness, dysphoria, lethargy, all these are seen when there is overdose. And on the serious, there can be fall in BP, hypotension can occur, and this local anesthetics, mainly lignocaine and procaine, are used as anti-arrhythmic drugs. Okay, they are class 1 anti-arrhythmic drugs. This is also one of the important uses. Non-anesthetic use of local anesthetics, anti-arrhythmic, and bupivacaine is a cardiotoxic. So these are the effects. Moving on to the adverse effects, so we already saw CNS, it can cause dizziness, auditory and visual disturbances. Also lightheadedness can also be seen. This is also one of the side effects of this local anesthetics. Hypotension and bradycardia can occur, and local effects, it can be painful. Okay, local tissue toxicity is less, but the injection is painful because these are amide derivatives. There can be some hypersensitivity reactions also. So one more important thing which you have to know in case of local anesthetic is EMLA. EMLA is eutatic mixture of local anesthetics. Okay, eutatic mixture of local anesthetics, very important. So what do you mean by this eutatic mixture? So for surface application, that is for topical use, what they do is they will mix two local anesthetics, that is lignocaine and prilocaine. Okay, these two are mixed at equal concentration of, say this example, it is 2.5%. okay, they are mixed at equal proportion at 25 degrees Celsius. Okay, they are they result in an emulsion, and mixed in emulsion along with water to form a cream. This can be used as a topical applicant in case of wound dressing, or in case of IV cannulation, okay, split skin graft harvesting, in these conditions, or other superficial procedures. So you can use this eutatic mixture. This is also frequently asked question. Individual drugs, so cocaine is not commonly used because it is a CNS stimulant, and there is drug abuse of this drug, so it is not commonly used. Only indication is ocular anesthesia, but there also it can cause corneal sloughing, so it is not commonly recommended. So lignocaine, very commonly used, so it is used as with different indication. All these are very important. It is used for surface application in case of mouth ulcers, and in case of infiltration of anesthesia, nerve block, epidural anesthesia. Okay, percentage is very important. So 4% is for topical application, infiltration and nerve block 1%, epidural spinal, it is 5% lignocaine, intravenous regional block 0.5%, and it is also used as an class 1 anti-arrhythmic drug, as we already saw. So it is also one of the important indications of lignocaine. So bupivacaine trending, and this is very important. It is the local anesthetics which is used for spinal anesthesia in case of labors, okay, and in case of cesarean sections. So bupivacaine is the local anesthetics which is used because it is potent and long acting amide. So other indications are infiltration, nerve block, epidural and spinal anesthesia. So disadvantages, it is little cardiotoxic. So it is not used in case of IVRA, that is intravenous regional anesthesia. Ropivacaine, it is a bupivacaine conjurer with lesser cardiotoxicity. Moving on to the individual techniques. So we saw this local anesthetics, they are used as surface anesthetics, infiltration anesthetics, conduction block, spinal anesthesia. They are also used in case of epidural anesthesia and intravenous regional anesthetics. So this picture shows what is the area which is anesthetized with different local anesthetic injections. So topical, only the skin and superficial layer is anesthetized, whereas infiltration, so a part of it along with a little part of nerve, and field block, it is usually up to the trunk. Nerve block means the whole nerve the whole area which is supplied by that nerve is anesthetized, whole of this area. Surface anesthetics, as we already saw, so most commonly used surface anesthetics is tetracaine and lignocaine. Okay, which conditions they are used? They are used for painful lesions like mouth ulcer, even in case of tonsillitis, intubation in these cases. Stomatitis, I already mentioned, sore throat, in those conditions also you use. Gastritis, esophagitis and heartburn, also you have lignocaine preparations. And IV cannulation and skin grafting, you take mixture of lignocaine and prilocaine. We already saw EMLA. So there also lignocaine is used, and also for catheterization and dilatation also we use lignocaine. So technique, infiltration anesthesia, this is mainly used in case of minor surgery due for incision and excision, hydrocele, herniorrhaphy. So in these conditions, infiltration anesthesia is used. Conduction block, where a nerve trunk is involved. It can be field block, where we give subcutaneous injection. Okay, for procedures like herniorrhaphy, appendicectomy, lap surgeries, all these, and scalp stitching, all these field block is preferred. And nerve block, it is mainly where the injection is mainly given in at the nerve trunk or at the plexus. So any particular area which is supplied by that nerve, whole of which it will be blocked. For example, ulnar nerve, if there is any orthopedic procedures, or in case of sciatica, sciatic nerve block, brachial, trigeminal, facial, all these can be blocked through nerve block injection. Important one is the spinal anesthesia in case of local anesthetics, and you should always remember spinal anesthesia is not a general anesthetic, it's a local anesthetic. So that point is to be remembered. It is injected into the subarachnoid space, where at L2, L3 or L3, L4. So this is the area where you give spinal anesthesia. And site is nerve root in the cauda equina. So this is where we give spinal anesthesia. So it will anesthetize the lower limbs, pelvis. Okay. Prostate fracture settings. So obstetrics procedure, cesarean section, all these can be done with the help of spinal anesthesia. What are the complications? There can be respiratory distress, hypotension, headache, very common side effect of spinal anesthesia is headache. Cauda equina syndrome, there can be pressing, septic meningitis because of inappropriate technique. There can be infection which can lead to meningitis, nausea and vomiting. So post-operative, not pre-operative, intraoperative, anywhere you can see vomiting. Contraindication, it is contraindicated in spinal anesthesia in case of hypotension, hypovolemia, mentally ill, uncooperative patients, children, infants, vertebral abnormalities and sepsis at the site of injection. So these are the contraindications for spinal anesthesia. So this is the technique. So in the L2, L3 or L3, L4 is where you give spinal anesthesia. This is epidural, which you'll be studying later. So this is the epidural space. So here you give epidural, but spinal anesthesia is given in the subarachnoid space. So this is in the sitting position they are giving spinal anesthesia. So one more trending type of anesthesia nowadays is epidural. So this is helpful in case of even thoracic and abdominal surgeries. So that is the importance of this. Any thoracic procedure also can be done. So mid thoracic space used for pain relief after thoracic or upper abdominal surgeries, so epidural anesthesia. And also lumbar anesthesia is used for any pelvic or lower abdominal hind limb surgeries. Caudal or sacral cranial canal via sacral hiatus. This is used in case of vaginal deliveries to produce painless vaginal deliveries. Anorectal or urogenital operations. Last thing, that is intravenous regional anesthesia. It is also called as Bayer's block. So here what they do is that they tie a tourniquet so that the blood does not enter the forward area. Only this part will get anesthetized, and you give the anesthesia and do some procedure like external fixation, and this is mainly done for orthopedic procedures. So this is Bayer's block, intravenous regional anesthesia. Okay, with this we end with local anesthetics. Very short and short chapter. So very commonly asked question is its mechanism of action. How do they act? So they mainly act by sodium channel blocking. Which sodium channel? Activated, inactivated, resting, or any stage. So this is important. Usually inactivated stage is what is blocked. And this is also one of the important question. Adrenaline, what concentration? So I told there it is 50,000 to 2 lakh. So here the answer will be, so 1 is to 1 lakh dilution. So this is one more important MCQs. Okay. Thank you.